Good morning, everybody. It's a pleasure for me to introduce to you GETApp. It is an application to really obtain the best treatment plan of your patient. This application combines aesthetic and functional parameters that will be followed step by step in order to really achieve at the end the greatest treatment plan for our patients. Please follow me on the step-by-step procedure. We are in front of the patient and we have to decide what to do. It means that we have to do a new case in this particular situation, and so we push the red button over here, new case. Of course, together we have the library and in progress cases, so cases that were already examined but not finalized yet. So now we are approaching a new case and we push new. And of course, before starting, we have an alert that is explaining us that we will talk not about the fact to maintain, to keep or to remove a tooth or position implant, but just about the position of the teeth, orientation of the occlusal plane, and the position of the teeth in terms of length, to be more apical, more incisal positioned, or to be more buccal or more lingual positioned. Once we understand that, we start to collect the data about the patient information. We can write down our names, of course, plus that of the patient. And of course, the patient age, the patient sex and gender will be very, very important because, of course, will be put in the brain of the app. It will remember later on, and it will be very interesting because there are different situations in relationship to the age and to the sex of our patient. So, we will meet the first step, talking about anamnestic evaluation. We put no because, of course, everybody has signed already all the data in their folders. So, we then push continue. Okay, now we are on the subjective perception by the patient. And of course, the patient was really aware that he had a lot of wear. So we put tooth wear and long, short teeth, in this case, short teeth. So that is exactly what the patient complained, and especially functionally, the masticatory dysfunction, because the wear was really, really very high level even on posterior area. Now we are on the step 1.7. And the step is the patient treatment requested. Actually, the patient knows perfectly that he needs to have the full upper arch done and the full lower arch done too. So the complete rehabilitation case. So now we go ahead and we go to the 1.8. And the patient, what the patient requests? He requests some alignment, yes, appearance, adult, tooth type, mostly ovoid, slight microtexture, and slightly characterization. Of course, the question, highly demanding patient, yes or not? Of course, yes. All the time we try to really stress the dental technician to do their best, so that's the reason why we said he needs a really high level of the final work. So now we can go ahead. 1.9, we try to examine the case, the objective examination, and I can tell you in this worn dentition we can put severely structurally compromised. That the only problem the patient has is a generalized wear, anterior wear and parafunction. We can put with severely structurally compromised, we can really touch every tooth because all the teeth are affected by wear. They have a problem of wear. So we go ahead from 1.9. We are now on the 1.10 and we are examining the lower arch and the lower arch. Similar situation, parafunction, generalized wear, anterior wear, and we can again push severely structurally compromised teeth. All the teeth are really compromised anteriorly and posteriorly. So now all the data will be collected by the app itself. It will be working really great over time. We'll see later. So we go ahead. And now we have the 1.11, skeletal class is 1. Going ahead. And now we are on the picture of the patient. So now I want to explain to you that if you push high, for example in the left upper, you see what kind of picture you have to do it. It means that you can now understand what is the position that you needed to do it. Like, let me give another example. Right inside the profile, I push I, and again, that's the profile of the patient, inside the profile of the patient. So we can have for every picture exactly the right situation. You need to take all this picture, because if not, the arrows on the right lower side, they will be gray and not red, so you cannot go ahead. So if you click the camera picture, you can have the gallery, you can take all the gallery of the case that you have done. So all this information are needed to the clinician. All these pictures are needed for the clinician. So we can take a picture directly with the iPad. You see that there is also a mask that you can use it. You can calibrate, first of all, the iPad to be sure that it will be perfectly calibrated, actually. And at this point, you can start to take the picture. You can follow the mask, as I said before, as you can see here. We have a different kind of mask depending on the position of the patient. And of course, the patient should be in a natural head position that we have found since the beginning. And now you can detect all the picture. That is great because you can use the iPad directly without using any other camera. Now we have all the picture in front of us. I would like to better explain what you find in the GETApp on the upper side. It means that you see the red circle are all the picture. I mean, all the circle are in red, and that is all the data collection. Then it starts to be green, gray, and that become the data processing for the treatment plan. So it means that you can divide it into steps. One with a red circle with your patient in place in front of you, and the other one can be done, of course, at home or where you want it, just because we have all data already collected, so now you can do your treatment plan. More than that, you can find close to the red button that you have seen already. Red button is something that explains to you, as you have seen, all this information about how to take the picture, etc., all the information of that screenshot. You have to remember that this red button is present in every screenshot, but you go back and you can have also other information. For example, the left side, same line, but the left side, you have a question mark, upper on the left side. And you push this button, you can find all the explanation, how to move your hands, how to use the button, how to use all these examples. So helping the practitioner in a very, very good way. So you have also close to the red button on the right upper side. This logo helps you in seeing all the picture. That is possible to see in every screenshot from now to the end. So it will be possible to see all these pictures if needed. Plus, you have again the little pen that helps you to write something, just in case you want to add some other information. Save or cancel, in this case cancel. And now you have also the scroll. You can see you have all the steps. You can go directly to the steps you wanted. You don't have to be blocked, or you have not to go ahead one by one. It is very, very useful again. So now from the step 2.1, we go ahead and we have some optional photos of the patient in 2.2. They are optional, so that's the reason why the red arrows is still present on the right lower part. And now we are in front of the videos of the patient in the step 2.3. Now we have to do some videos. Like in the picture, we have the eye. Now we push the eye and we can immediately see an example of the video that you should do. Like for the picture, the same kind of steps. Differently from the picture, your iPad can be moved from one side to the other side in order to really catch the position of the teeth in compared to the to the lips. That's the most important step. In this case, you don't need to natural position. We need really to catch all details. That's the most important step. Also natural position and tooth exposure at rest and smile line of the patient. So we try to really have all this data. And now we can discuss with the patient all this. So now we have collected all the videos that are needed. So we have all the information, all the data collection that we really need to go ahead. Now from 2.3, we go to the 3.1, starting with smile line. And according to the picture you see here, we try to check the situation, the clinical situation of the patient. We are more than sure that he has a low smile line. No high smile line, no average smile line, no gamma smile line, but really low smile line. That will be very important later. We will talk again about it. So we go ahead from 3.1 to 3.2, looking the labial corridor and the smile width. Labial corridor is the bilateral negative space between the cheeks, lips and teeth. And you see that in this case is quite wide. So we put wide. At the same time, we have the situation of smile width. We see up to 12 or even 14 teeth. And we can push this button here. So now we go from 3.2 to 3.3, interincisal line evaluation. We have a kind of right inclination, it's not completely vertical. And talking about the interincisal line versus upper lip philtrum, we are more or less centered. So we are not deviating the right or left. So the only step is the right inclination that the patient has. Go ahead from 3.3, we go to 3.4. We're not talking about the causal plane orientation and the incisal edge position, looking the patient from the front. And what we could see here, we have a kind of ideal situation in terms of causal plane orientation, even though it's slightly inclined, but more or less quite ideal. And we have between flat and reverse, between flat and convex situation. We can see convex, but actually almost flat. So from 3.4, we now are in the 4.1 step. At this point, you have to select the reference tooth, the right central incisor or the left central incisor. Doesn't mean that you have to really choose the right one. We choose the one that is closer to the ideal, but not the ideal one, because ideal will become later, hopefully. So we click 11 in this case, and automatically the app will select the antagonist, that is the 41, because we are talking not just about the 6 upper anterior, but also the 6 lower anteriors, as you see later. So we go ahead from 4.1 to 4.2. And we are now looking at the dimension of the upper central incisors and also the exposure at rest. So the length of this central incisor is 8.72 and the width is 8.99, so 9 millimeters actually, but we write down 8.99. And the exposure at rest is minus 3.5. I would like to explain it better to you what it means minus 3.5. We have, for example, here a video example that I try to check with you. And you see that in the video example here, you can have the chance to see the teeth when you have the muscles that are more relaxed. So you can help the patient to relax the air muscles, for example, like in this way, as you see here. You can see upper lower that are relaxed. We have some rest position. So you can sign exactly what is the value. In this particular case, if I push the red button on the upper part, you see that we have a kind of explanation about the value, the negative value, minus, instead of plus or 0. Why don't say 0? Because of course, in this situation here, so you see that we have some text over here, but also some picture. That's, I think, the most important one. It means that you see, you have no visibility of the upper teeth at rest, but if you put your probe on the incisal edge and then you leave the upper lip going down, you see that you count minus 5. It's not the case that we are doing now, but it's another example. But just to explain to you how important it is to really measure this kind of distance between the upper lip and the incisal edge, because to have the chance to see the teeth again, the elongation should be more than 5 millimeters. So you know in advance what is necessary to really achieve the visibility at rest position. You should add more than 5 millimeters, as you can see from here. So going back, now we have already all the numbers that we needed. We go from 4.2 to step 4.3. Now we have to check the dimension of the lower central incisors. At the same time, we have the same situation. You can write down the length 8.78, that is the length of the 41, and the width is 5.64. The exposure at rest at this point is has a positive value, is plus 3 millimeters. So are already quite visible. So you have also the video example of the same one, but we have seen already in the previous one, so we don't need to see again. We go ahead and we go to the 4.4 step. That is related to the anterior occlusal relationship, meaning that we don't care only about aesthetics, but also about function. So now we have to check the overbite, overjet value. Normally we use the method to measure the back side of the upper and the back side of the lower to have the overjet value. But I don't think it's the right one, the right method to do it. Now we check it together. So now we put the value, is 3.5 of overbite actually, and overjet is about 1 millimeter, more or less. We check later. So at this point, we have also to check if we have any anterior dental contact. That is absolutely important to be the starting point of an anterior guidance. And also the value of the incisal wear, because remember, this patient has a big, important wear. So the incisal edge thickness is about a couple of millimeters. It means that is quite important incisal edge value. Normally is about 1 millimeter. So again, we measure normally from, the density of overjet from the backer part of the upper teeth and the backer part of the lower teeth. This is the total amount that is visible for the dentist using the probe from the noon position, if the working position is the noon position. But we have also to understand that this value can be not the right one, it will be not the functional one. The functional one, if you have a shortening of the upper incisal wear, will be different, because if you go more to the apical position, the thickness of the incisal edge becomes greater and greater. So at this point, if the total amount from buccal to buccal, upper, lower, remain 5 millimeters, for example, the real one is much shorter, much narrower, like 1 millimeter, like in this case. So the occlusal and the functional overjet has to be measured from lingual part of the upper teeth and the buccal part of the lower teeth. Last but not least, the palatal wear. The palatal wear, it will be actually, we sign here 2 millimeters, as we said. The buccal, the lingual part of the upper teeth will be, worn out or not. In this case, is not worn out. So now we have to put also dental contact. All the steps are finalized, so we can go ahead with the red arrow on the right bottom. So from 4.4 we go to 4.5. So the arrangement of the upper anteriors. And that is be nice because you can move, for example, the lateral incisor in this position, more in, more out, as you like it. You can also have some rotation. You can select the tooth and have some rotation. That is also important when you have discussed with the patient if you want to some natural appearance, if you can move, overlap or underlap the tooth. And actually is a way how to explain exactly what is your idea. So that will be memorized also again from the app. Now we can go ahead from 4.5 to step 4.6. The same thing will be the arrangement of the lower arch. In this case, the patient missed one of the incisors, of the lower incisors, but still, the remaining teeth are more or less aligned, so we don't have to modify anything in this case. So move from step 4.6 to step 4.7. So now we have to evaluate the lower incisors, if they are over-erupted, under-erupted, or if are they in the right position. So does the lower incisal plane match the posterior occlusal plane? That's the question. In this case, yes. So we push the bottom in the middle. If you say that are over-erupted, you can also check how much will be over-erupted or under-erupted if you push the other button on the left side. So we can then know exactly what is the compensation we need to do occlusally in the prosthetic rehabilitation. Now we go ahead from step 4.7 to step 4.8 and we look at the inclination of the lower incisors. Should be two lingual incline, normal incline, or buccal incline. And in this particular case, we don't see any kind of lingualization or buccal position. We can push normal inclination. Now, we push the button to go ahead, the red arrow, and you see that we have some steps that can be collected. So, do you need more detailed data collection? You can have more information on color, to endodontic treated teeth, to the remaining tooth structure, or also to periodontal health. So we can push continue. At this point, we can collect all this data. That are optional data, so you can use it or not use it. It depends on you. In this case, we are showing you in order to have a better explanation of what we do. So, initial tooth color, in this case, we can use a VitaPan shade guide from Vida, and the initial color we have checked is B8.3. The value, high and low, are not selected yet. That's the reason why the gray arrow is still present on the right side on the bottom. So the value is right in the middle. Now we have a red arrow, so you can go ahead. And from the step 5.1, we arrive to step 5.2. And we can evaluate the endodontic treatment done, or that has to be optimized in the patient. So maintain, you can push what you want, or clear it and treat it. Like in this case, has to be treated. Okay, and that will be one possibility. So we go ahead again. And the same options you have also for direct or indirect restorations, posts, and implants. So you can really put in this everything you wanted. So you can have a direct restoration that has to be made on the central incisor, and indirect restoration on the cuspid. I don't know, it's something like that. It's, you can put what you want. You can have all the options. From the step 5.3, you can go ahead, and then alert comes out and shows us what type of periodontal evaluation do you need, simplify or complete. We can push simplified, continue, no gingivitis, no periodontal disease, intact support on the periodontal ligaments, and biotype is quite thick. You can also upload the image with the X-rays image. You don't need in this situation here, we don't have here. So I push the red arrow on the bottom, and now the app asking me, all your data have been updated. Do you want to continue with data processing? You have two options, save and close or continue. Save and close, it means that you don't need anymore the patient. The patient can go home. It's finished. So we can have all the data collection made, so you can finalize your treatment plan, so the data processing at home or the day after or when you want it. But in this particular case, of course, you want to continue, and now we have the chance to analyze the patient step by step, even though the patient is left already. So you can enlarge the image, and you can measure. You can move your finger to optimize the situation here. And you see if the lower third is more or less in a proper position in comparison to the other part. So we see that is like 48%, that is okay, but if you look at maybe the lower thread will be decreased, maybe because he also lost the vertical dimension. I move the lower line, you see, from 48 that was green, I'm talking about the circle on the right side, become 44, 42, 42, it'll be red. So we'll be guided by the color itself. So now we go back, enlarge again to have the chance to see 48 more or less, 47, we put like before 48. And now we go ahead from 6.1, that is the step that we are analyzing now. So now in the step 6.2, we detect the profile of the patient. So we enlarge the image, we put in the glabella, okay, the base of the nose, and base of the chin, yes, we have 1.67 is again green, but if we move it, look at, from green become red. Is possible to see the difference. So actually it's very important to understand that that is the right value. It doesn't need to go to any part, any other color, but again, if you push and go to red and then you go ahead anyway, look what happened. You have another alert saying that you should send this patient to the orthodontic surgeon or to the orthodontist, but you can also ignore and proceed with prosthetic treatment. That's the way how to treat anyway the patient. You cannot send every patient to the orthodontic surgeon, of course, not everybody happy, so we can go ahead anyway. Continues, and we have the chance now to see the skeletal evaluation of the two positions. Enlarge the image again. We have the glabella more or less, and we can see the teeth, upper teeth a little bit inside. So we have high palatal position of the teeth. We go ahead again, and again, it's written here, you can go ahead with the prosthetic compromise, or you should have maybe an advancement of the maxilla or the mandibular or the lower maxilla, but again, that will be sent to orthodontic surgeon, and if you push green, the app will close, will be finished like that. But you push prosthetic compromise because you want to treat the patient anyway. So we push continue. Now we are in the step 7.1. We are talking about the horizontal reference line and vertical reference of line. So we enlarge the image again. We put the pupilla, the circle on the pupilla. And we can check now the difference between the horizon and the interpupillary line. So we will have the chance to see it is less than 1 degree difference. So we can relate this kind of final rehabilitation to the horizon, or if you want to the bipupillar line. We have checked that the occlusal plane and the eyes are quite parallel each other. So we try to follow the bipupillar line. So all this will be set now, moving the head of the patient to the horizon, but following the bipupillar line. So now we can go ahead, pushing the red arrows at the bottom. So now we move from the step 7.1 to the step 7.2. And at this point we try to zoom the upper lower arch, and having the chance to put this in the middle between the two centrals. And we go ahead, and we have this square, red square area here. We enlarge the image again, and we try to arrive to this position. Okay, we try to finalize this value here. Of course, this is exactly the value that we have already checked on the mouth of the patient. So the measurements are the length, the width that you have seen before. They are reproduced in this square over here. And now we see the ratio between length and width is 1:3. It means the width should be normally 80% of the length, like 11 in length and 9 in width, talking about the central incisor or the upper arch. In this case, it's the opposite. So the width is bigger, higher than the height. So it's 1:3 ratio. It will be completely wrong. So now from the step 7.3, we go ahead. Now on the step 7.3, we see an alert. And they ask me to keep the width or modify the width of the central incisors. We know that we have to elongate the teeth quite a lot. I would like to modify even slightly the width. So I push modify the width. And now it was 9, now it's 9.1. I just added tiny bit this width. Now, if I push the red button again to go from 7.4 as step to 7.5, automatically the app will give me the final numbers. And as you can see here, the final number is 12.6 term of length. That is red, and this seems to be wrong. But we have a green value of the final tooth exposure at rest. That is 0.4, and it's green again. So why is it important? And why I'm not worried about the length of 12.6? For one simple reason. The app knows that the patient has the low smile line. So we never see the total length of these central incisors. So the patient never will complain about it. It's much more important to see a part of the tooth, even 0.4 at rest. That will be much more important aesthetically than the total length of the teeth that will be not visible. So the proportion between width and length is not ideal. It's 72%, as you see, is orange circle over there, but it's not absolutely important in this case because the patient has low smile line. The app knows that. And that's the reason why it started its treatment plan not looking at the total length, the official final length, but the tooth exposure at rest for the smile line that it was low smile line. So now we go also to the other step, the 7.5. In the meantime, I would like to stress one point, because in the same 7.5 step, you see that the last part before the circle, you see the incisal lengthening 3.9 millimeters. That's the lengthening that you have to add it. And the marginal cervical shift, that is 0. It means that just in case sometimes you have an over eruption of the upper teeth, you can also put the number in which you wanna, the right number, the right value, or you needed to increase the length cervically and not just incisally. So this is a great option that the app gives to you, not just to lengthen the teeth incisal, but also cervical. So now we go ahead from 7.5 to the step 7.6, but again, the alert tells us what I told you already. As the patient presents a low smile line, in the next step, it's not necessary to further analyze the proportion of the teeth. Again, because nobody can see it for the low smile line. On the other hand, another alert tells you, select the number of the teeth to be treated. And we put 12. All upper arch will be to be treated. Continue. And we go ahead, and now we have to enlarge the image. Now we have the new length that are decided. We enlarge this image of the patient, and now we shorten it. And with the fingers, we try to optimize this level. We enlarge now the patient picture to be better possible to see it. You see, we have now more or less the position we needed. So we know how much we have to lengthen the teeth. So we, at this point, transform this occlusal or plane orientation. We can have different options. We have the logo of the two molars on the upper right. I push it, and you can see that we have different positions. I can be first class, second class, third class, more or less pronounced. I can see the third class or the third class less pronounced. And you see this case, at this point you have the chance to check it and to see how much you have to lengthen not just the central incisor but also the other teeth. So now I push the V in red. I have now the final outcome. Now I go back and you see how you can go from the step 7.6 to the 7.7. So we decided to increase the length of the central incisor about 4 millimeters, but now we want a more convexity of the incisal edge because it was quite flat before. So we decided to increase, for example, having also the chance to check it with this red line. For example, cuspid to cuspid, you know the cuspid the right side seems to be shorter than the cuspid on the left side. And also the models are the same, so there is a little inclination as you have seen before. So at this point I want to increase 2 millimeters here and 2.5 the other side. So we have a value that we have put inside. We go ahead from 7.7, the step 7.7, to the step 7.8. And now we have the first molar evaluation. Again, we can check it. First molar is here. Okay. And we put, again, the number is 1 millimeter on the first molar and 1.5 on the 26. So we are differentiating the two values a little bit. Now, ready to go ahead from the step 7.8 to the alert. The alert said to you, seems to be a wide labial corridor. So take a look and think about it of increasing the buccal surface of the upper teeth, because you have actually quite wide labial corridor. So we push continue and we can put everywhere a kind of enlargement of the arch. Let me say 0.8 everywhere. Of course, if you have some little difference between one tooth and the other, technician, when receive the models, can of course detect this kind of little difference. They can work closely to these numbers and to check it and to modify if needed. So now 7.9 is finished. We push again the red button, the red arrow on the bottom, right bottom, and now we try to check the incisor profile of the patient. How we can do it? First of all, enlarge the image. Secondly, you see the line, red line over here, we put over and enlarge again, tragus and base of the nose. Now, if you push the red button on the upper jaw, on the upper right, you can see that will be tiny bit more in. Is like 80 degrees. What that means is the angle between the campus plane, that normally is parallel to the occlusal plane, and the central incisor long axis. So that helps you in detecting the long axis of the anterior, the upper anterior, if they are right or are not well positioned. So we can try to modify. In this case, the incisor profile seems to be a little bit more in, you can put a little bit more out. And if you move, if it's written move back at 0.4, it means that in this case you can save some tooth preparation thickness of the upper tooth. So go ahead now in the step 8.2, you have the F sound. We try the F sound, we push the arrow over here, and you see the patient of the value of the patient. You see that more or less we are inside the vermiform border of the lower lip. It means that we have the chance to see it. The teeth are not touching the dry part of the lower lip. Is internally positioned, is lingualized, and is lingualized about a couple of millimeters more or less. So we know that just in case we need it prosthetically, we can go more frontally, more backally with this incisal edge. So from the step 8.2, we go ahead and we arrive to the step 9.1. That's a very important step. Why? Because this step shows you the new position of the upper central incisor that we have determined on the basis of the static, phonetic, and functional analysis. And we can highlight the difference between the initial position with the black dotted line and the final one with the continuous red line. But at this point, you can also modify all the values. Let me check with you. First of all, we can see you have some red numbers starting from the upper 11. You have 12.6, but we discussed already about this part. So we can still keep this length because the patient doesn't show all the length because you have a low smile line. But at the same time, we have a very good number in terms of rest exposure at rest, 0.4. So finally the patient can show some part of the teeth at rest. The ratio of proportion again will be 72%, not perfect but not so bad, it's still orange. Then lower arch 41, 8.8 millimeter length, 3 millimeter position. Both are perfect because they are green. Then we have overjet value 2.8, perfect. Overbite is absolutely bad because 7.3. So, but what is missing now? It's missing one important step. We are talking about the full mouth rehabilitation. We are talking about the need, in this case, due to the big and important wear, so in this worn dentition, to increase the vertical dimension. Now, how much you want to increase it? More or less we decide to increase 3.5 millimeter, but before doing that, there is another alert. You decide to alter the VDO. In order to optimize the value of the increase, push the red button on the top on this page to display the clinical information. So the app wants to tell you, to give you some tips, some tricks, some advice. So now we go back to continue, and now we push the red button. And you see, you have a functional aspect, video alteration, possible prosthetic option, overjet final value, overbite final value, aesthetic consideration, a lot of information, a kind of ebook behind, a lot of information. Not just that, we can also push on the left button, the eye, you see, close to the cancel U modification. You push the eye, and you see that you have, again, possible treatment option on the overbite and overjet values. So improving the overjet with the following modification, improving the overbite with the following modification, acceptance of the value, even not ideal, etc., etc. So you have a lot of information here. You have really to have the chance to understand how much content is inside the app. Plus, go to the upper part on the left side. You see the question mark? The question mark, if you push it, look, is all the information how to use all the buttons. That's not only in this screen show, but is shown in other screenshots, not just in this one. So this one is one of the screenshots where you can find all this information. This helping you a lot, incredibly. So going back to the main screenshot. Now, we increase the video, we set 3 mm.5, and you see that now we have a distance between upper and lower, of course, in normal. But you have to close it, you have a contact at the end. The final goal is to have a contact. So you have different options. For example, you can push on the upper right, lower. It means that now you can go down to the length, to the bottom, right, on the bottom. You can push the plus, go. You try to be the contact, but you see, on the other side, lower 41, you see that you become from beginning that was green, 8.8, now overnight become orange, now 9.7, 9.8, now become red. So still, you have no contact, we have red number. Please consider that behind the lower value of talking about length, you have also the rest exposure that is 4.5, still green. It is much more important the tooth exposure than the tooth length of the lower, because you almost never show the whole length of the lower teeth, just in the case that you have an over eruption. At the same time, I don't want to elongate so much the lower, so I go back and I will maintain like something like, let me say, 9.2. Okay, now we have still very good value of the rest position, the rest exposure. So at this point you have still no contact. What is the next step? Next step, you go again the up part, on the upper, you touch the upper, and now you have to go to palatal thickening on the lower part. You have to add, so plus, push plus, you see, now you have a contact, possible contact. So we have increased the thickness of the lingual concavity of the upper teeth. That again will be, as we said already, maybe a full veneer. So an extended veneer to the lingual part. Now we have a contact and we have the chance to see all the values are okay. We have, only the length it is outside the right value, but we discussed already because you have lost my line, so that's not the problem. We can say yes, overbite, overjet are not perfect. Overbite is 4.2, overjet 3.5, even too much. We can reduce the overjet tiny bit, so we can go again to upper, and then to the incisal lingual displacement. You put this one, and you can arrive up to 3 millimeters, that is green. So it will be perfect situation now, and that is what we want to achieve at this point. That is what we want to give to our dental technician and to our colleagues, other specialists. So we can customize, as you have seen. You can accept the value that the app gave to you that are already great, or you can modify tiny bit and achieve best result. Now, from step 9.1, we go ahead and we arrive to the prosthetic solution, 9.2. So what we selected is this, as you can see. Why? Because on the upper, we have extended the buccal position of the restoration to the lingual, because we have to find a contact with the lower arch after having increased the VDO, the vertical dimension. So now we have a contact, as you have seen, increasing the thickness of the lingual part of the upper teeth, plus we just do some veneers on the lower arch. So full veneer on the upper, regular veneer on the lower. The question now going ahead is the following. Do we wish to also restore the other teeth of the lower arch? The answer is yes. Continue. And we go ahead now and we see that we have some value that's already there. So it means we have 3.9 on length of the 11, and of course we can add on the 21, and we have the same value right now. We have 3.9, 3.8, 3.9, more or less the same value, okay? Then we go to the other side, talking about the width. We have increased the width of the central incisor, the right one. We do also that of the other central incisor on the left side. So it will be specularity, symmetrical specularity between the two centrals. We go from the step 10.1 to the step 10.2, looking the movement to the back or to the labial. But in this case, actually, we have not modification really. The only one, just tiny bit, could be done on the lateral incisor, this one. And we can put a kind of 0.2 more out, because it was a little bit more in. That's the only modification we do in this aligned teeth. We don't want to put more out or more in. And the alert again, do you wish to furnish additional notes on the idealization of the anterior dental composition? We can say yes. We can, of course, optimize if needed. We can optimize, push continue, the tooth-to-tooth proportion, creating kind of dominance of the central incisor in relationship to the lateral incisors, having the long axis idealized 100%, and then we can have the interdental contact area that are following more or less the curvature of the incisal curvature of the incisal edge. So the contact are extended more between the two central than the central lateral cuspids, and this way automatically creating a wider interincisal angle from the central incisor to the cuspid wider. So all these steps can be optimized, plus the lateral incisors that normally are included in two hypothetical lines that you can draw from the incisal edge from cuspid to central and also from cuspid to central on the cervical. So that will be something that you can put some notes, some modification that you needed, that will be perfect. So from 10.5, from the step 10.5, we can go ahead to the 10.6. You can enlarge the image and saying we have increased the 41 0.4. Then looking the other teeth, we can say we want to lengthen it, for example 0.2, the 42, 0.2 also the other incisor, not the other cuspid, sorry, and then 0.4 for the other central incisor, that is the lowest, and then 0.2, and then 0.2. So more or less we don't need to also change the width because you have no space, enough space to do it. So now we can again move from step 10.6 to the step 10.7. In this case we would like to do some movement backally. So we push the arrow on the bottom like that, become white, and then you can say I want to push all these lower teeth, anterior teeth, to the back side. How much? Just slightly, 0.3 millimeters, that is your choice of course, and then you can press again the red arrow on the right side in the bottom, moving from step 10.7 to step 11.1, in which we start to talk and to communicate closely with the laboratory, with the technician, dental technician, but also with other specialists if needed. So we can ask for WhatsApp, you can ask for a mock-up, for provisionals, or also for a final prosthesis. It's up to you. You can write some notes, and then you go from 11.1 to 11.2, in which we look at the functional aspects. We will work on the semi-adjustable articulator. We want to have some kind of incisal guidance and canine guidance to exclude the posterior teeth on the excursive movements. We want to use the face bow, the arbitrary one. So from 11.2 we go to the step 11.3. We will use a semi-adjustable articulator. We have 0 in immediate bayonet because we are in CR, in central relation. We want to put 10 degrees on the bayonet angle, and we can have now the condylar angle, condylar eminence angle. Could be standardized to 20-25 degrees, or you can use a protrusive record in order to sign with the bite record this kind of customized condylar eminence angle. So we push again a red arrow on the lower arch, and now we see here type of restoration, upper arch. We discussed already. We have to cover completely the 6 anterior because you have increased the vertical dimension, so we extended the buccal restoration to the lingual to occupy the space that is created by the increase of vertical dimension. So we do the full coverage on the all 6 anterior. Of course the space decrease on the posterior area, and in this area we want to have occlusal coverage. Can be tabletop, can be buccal occlusal veneers, depending on aesthetic need of the patient. That's for the upper arch. The same thing for the lower arch. So from the step 11.5 we go to the step 11.6. Differently from the upper, we don't need to reverse your restoration anteriorly to the lingual part. You can do just regular buccal coverage, buccal veneer. And that's the reason why all the 6 anteriors are just parallelized with the buccal veneer. Now, again, like in the upper, occlusal coverage will be positioned on the other posterior segments. So at this point you have defined all this restoration design for our dental technician. And now I press again the arrows, and now there is the selection of restorative material. Of course, I would like to do full veneer on the upper teeth. I said 11, 12, 13, etc., etc. Okay, so we push this. And I can use, in this case, for example, I want to use, I don't know, layered lithium disilicate. And now the alert says to me, is the use of the same material planned for all teeth concerned by full coverage restoration? What is the answer? Of course, yes. I want to have the same material. So automatically we will have all the material on the upper jaw with the layered lithium disilicate. Then you go to the other posterior upper elements. And they say the same thing. Now I want the monolithic lithium disilicate. I don't want to have the layered. I want to avoid chipping, so I put this. And the same question. Of course, I want to have the same material and all the same restoration, all the upper, done. Now we have the lowers. At the lowers, maybe I want to, again, the layer lithium disilicate, and again, yes. So now all teeth are selected. So now we have selected all the restorative material for our case. So from the step 11.7, we go to the step 11.8. Remember, the initial tooth color was 8.83 Vitapen, but now we want to decide what will be the final outcome, which color. And we want the A1, but even though we have selected the A1 color, you see on the bottom right side we have the gray arrow. Why? Because you have not detected or selected the value. Remember, it was like in between low and high. Now you want a higher value. Let it be higher value, more brightness. Now the arrow become red, so I move from step 11.8 to the step 11.9, in which you have the chance to select the color of the abutment, because we are talking about full ceramic restorations, and the color of the abutment underneath is very important. We have more or less a regular color, but we have more intense color on the two cuspids, on the upper, two cuspids on the lower, and we have less colored, or maybe even less than that. It's like, you can say 2, 2, 2, and 2 instead of 3. And we have 1, 1, 1, 1, 1, 1, 1, 1. So quite light color on the lower and upper incisors. So now we move from 11.9 to 12, in which we can see the summary of all the modification we made on our planning, thanks to the GETApp, thanks to the help of the GETApp. So we can see all this value is a summary, what we have decided together with the GETApp. We have the frontal view. So we go ahead from step 12.1 to 12.2, in which we see on the upper anteriors we have just 0.2 of buccal position of the one lateral incisors. The other 5 anteriors on the upper jaw are not modified in terms of buccal or lingual position. Differently, the posterior area on the upper arch will be more out, 0.8 as average from bicuspid to molars. At the same time, you see also the lower arch, in which we decide to go more out of 0.3 millimeter in order to have less invasive procedure with our final preparation of the veneers. Why? Because you have already gained 0.3 thickness of your final restoration. So you have to prepare less to obtain the same result. That's just great. So now from the step 12.2, we go ahead to 12.3, in which we have the summary. Again, what you have done. You see the final outcome of the rendering, the step 9.1 on the left side, dotted line and continuous line in red of the final outcome. So we see the original overbite, the final overbite, original overjet, final overjet, video alteration 3.5 divided between lower and the upper, as you have seen already, and then all the final restoration made. Occlusal coverage on posteriors, upper, lower, but full veneers, full coverage with full veneers on the upper anteriors, and buccal coverage, buccal veneers on the lower anteriors. So now we have the final notes for dental technicians or for other specialists, and notes for the clinician, exactly, for other specialists, for maybe the pediatric surgeon, the orthodontist, the implantologist. So now you can sign what you want. At the same time, you're ready to communicate with the lab the final PDF. That will be great for technicians to receive all this information without inventing anything. We know, for experience, that many technicians have to invent many steps. In this case, nothing to invent. It's already all the data inside, just put it in your work. That's the point. So now, final outcome, we can put the date, and we can also click the button, the red button, to have the PDF. But before doing that, remember that you have to use a reader like Adobe Acrobat Reader. That will be the best way to do it. So we press this and upload the case. Now we have finished the PDF, is completely uploaded, and now we can have the chance again to see the initial screenshot. And now we push library, and we check it, we see the patient again, we push PDF, and now Adobe Acrobat. And now we see that you can scroll, have the chance to see all the pictures with the little logo that are needed for the dental technician to upload in their computer in order to be able to then enlarge the image if needed. At the same time, also for the video, you have to push the logo on the right side, as you see here, and you can see the video too on the normal computer, the laptop. So you have all the information. Technician has not to invent again anything. He has all the data collected and processed in a proper way. So he can of course call you back or send an email or have some chance to communicate with you in order to have maybe some changes if needed, but of course 99% of the process is already done. Without any doubt, we have facilitated incredibly the work of our dental technician and also of our colleagues that helping us during the day, every day in our office in order to finalize the case in the perfect manner. To share all this data with our technician, you have to push this and to share, on the bottom right side, share the file, original document, and then again you can send, for example, by mail. Again, that is the mail that you can use it to share with the dental technician or your colleagues the file. That's valid for pictures and also for videos. So thank you for staying with me, and I hope you enjoy the presentation. I hope that you understand how much important it is up for daily work of all the dentists, and of course to have all the information about it, you can go to fradeanieducation.com. At the same time, you can go to the app and go to the Apple Store, and you have to look at Fradeani, and then you'd find GETApp. So I hope to see you soon. Bye.